2 million women around the world are affected by breast cancer each year. Today, we're speaking with Dr. Sumeet Mendonca and Dr. Emily Ho with Ironwood Cancer and Research Centers. Dr. Mendonca, can you tell us how common breast cancer is and what's the U.S. incidence of breast cancer?
Thank you for having us, Suzanne, to talk about this very important subject. Why is it important to increase awareness of this particular malignancy? Breast cancer is the leading cause of cancer death in women worldwide. Globally, it accounts for over 2 million cases each year. In the United States, it's the leading cause of female cancer, accounting for over 260,000 cases in a year with over 40,000 deaths. Over the last few decades, there has been a decrease in the death rates associated with breast cancer. And that is because of increased awareness, increased screening, and treatment. Therapy helps to save lives when breast cancer is detected early.
Dr. Ho, what are the screening guidelines and what's your advice to women, especially during this pandemic?
Sure. So we still recommend screening, annual screening mammograms starting at age 40. So once a year is all you need. Especially this year, a lot of women have either opted themselves or have been asked to postpone their mammograms. Most of the imaging centers are now open with safety precautions in place. So we definitely encourage women to make sure that they schedule for their 2020 mammogram this year. We know that early detection saves lives, so it's really important.
What happens if one has an abnormal mammogram or finds a breast mass on a self-exam?
So with abnormal mammograms, of course, that always sounds really scary. What that usually means is just that that there was something new found on your imaging that wasn't seen last year, or it might be an area that they were following that looks a little bit different this year. Usually all it starts off with is additional mammogram views, usually magnification views. Sometimes you might be called in for ultrasound exams as well. And depending on what they see, certainly if it doesn't persist, then you'll be recommended to resume annual mammograms. And if it does look a little more suspicious, you might be either recommended to have a 6-month follow-up rather than waiting a full year, or they might even recommend a biopsy. As far as self-breast exams, we do recommend self-breast exams in between your annual mammograms. So once a month is all you need. Usually we recommend starting in the shower with a visual exam, and then you want to examine your breast both with light and deep touch, so you're getting all of the breast tissue. There's different techniques that you can use, and then a common follow-up question is, what am I looking for? So there's a nice campaign called Know Your Lemons that kind of has a visual of, different skin changes, either skin thickening, redness, and certainly lumps and bumps that might be concerning that you should bring to the attention of your healthcare provider.
What are the various treatments for management of breast cancer that women need to be aware of?
Breast cancer management really, it's really 2 mainstays of treatment, and it really does depend on the type of breast cancer you have. So not all breast cancer is the same. Some are more aggressive than others. So the 2 mainstays of treatments that I mentioned are local therapy, which treats both the breast and the axilla, and then there's also systemic treatment or whole body treatment that usually involves medications. With local therapy, that's usually where I come in as a surgeon. Usually the options are either breast conservation or lumpectomy followed by radiation, or mastectomy, which is removing all of the breast tissue.
Do all patients require chemotherapy? The answer is no. The key point to remember is to have a comprehensive, strong breast cancer team on your side. Breast cancer management requires a multidisciplinary approach, and we can provide that for you here at Ironwood.
Thank you both for all your advice and helpful insight. There are 10 Ironwood Cancer and Research Centers throughout the Valley. For more information, visit ironwoodcrc.com or call the number you see on your screen.